Have you ever pondered the complexity of your spinal cord and what could happen if it malfunctions? Imagine a superhighway of information, a conduit of messages that keeps your body and mind in constant, seamless communication. That's your spinal cord, an essential part of the central nervous system. It's a soft tissue structure, about as thick as your thumb, extending from the base of your brain to the lower back. The spinal cord is the link between your brain and the rest of your body, relaying messages back and forth. It's like a two-way street where the brain sends commands down the spinal cord to control muscles, while sensory information from the body travels up to the brain. The spinal cord is your body's information superhighway, allowing you to sense the world around you and move through it. But it's not just a simple pipeline. The spinal cord is also a complex network of nerves and specialized cells known as neurons. These neurons not only transmit signals but also process information, making the spinal cord an integral part of your body's decision-making process. It's like a busy switchboard, constantly receiving and sending out messages. However, this intricate network can be disrupted by various conditions and disorders. Imagine a roadblock on a freeway, causing traffic chaos. Similarly, damage to the spinal cord can lead to a range of complications, from mild sensory changes to severe paralysis. These conditions include trauma, such as accidents or falls, degenerative diseases like arthritis, infections, and even tumors. Understanding these disorders is no small feat. It requires delving into the intricate network of the spinal cord, exploring its vast connections, and learning how it communicates with the rest of the body. The more we comprehend the spinal cord, the better equipped we are to diagnose, treat, and manage these conditions. Understanding the spinal cord paves the way for comprehending the severity of its disorders. And that's just the beginning of our journey into this fascinating world. So let's dive deeper and unravel its mysteries together. To delve deeper, we've sought the expertise of Dr. Jane Doe, a renowned neurologist. Dr. Doe describes the spinal cord as a complex highway of nerves, acting as a conduit for messages between the brain and the rest of the body. When this highway is disrupted by disorders or injuries, it can lead to a range of complications. According to Dr. Doe, spinal cord disorders can be caused by a myriad of factors. These include traumatic injuries, diseases like multiple sclerosis, or congenital conditions such as spina bifida. She further explains, the symptoms often depend on the location and severity of the disorder. They may range from mild numbness or weakness in the limbs to severe paralysis or loss of control over bodily functions. Dr. Doe also highlights the various types of spinal cord disorders. There are inflammation-based disorders like transverse myelitis, compressive disorders like spinal stenosis, and degenerative disorders like cervical spondylosis. Each type has its unique set of symptoms and challenges. These conditions can significantly impact a person's quality of life. As Dr. Doe puts it, imagine losing the ability to walk or struggling with basic tasks like dressing or feeding oneself. It's a stark reality for many suffering from these disorders. She emphasizes the importance of understanding the signs and seeking medical help promptly. Early detection, Dr. Doe says, is crucial in managing these conditions. The sooner the diagnosis, the more effective the treatment can be. In fact, advancements in medical technology have made it possible to slow down, halt, or even reverse some of these conditions. We now have sophisticated imaging technologies, surgical interventions, and rehabilitation therapies that can greatly improve the lives of those affected, Dr. Doe adds. In closing, she underscores the importance of awareness and education. Understanding these disorders, their causes, and their symptoms is the first step towards prevention and treatment. As Dr. Doe emphasized, early detection is key in managing these conditions. But what happens when a spinal cord disorder is diagnosed? Let's hear from Dr. John Smith, a leading spinal surgeon. Dr. Smith emphasizes that the journey of treatment is as unique as each patient. Every individual requires a personalized treatment plan, he says. There is no one-size-fits-all solution when it comes to spinal cord disorders. He goes on to explain that the initial stage of treatment often involves controlling inflammation and managing pain. This could involve medication, physical therapy, or even lifestyle changes. The aim is to maximize the patient's comfort and mobility while minimizing any potential harm to the spinal cord, Dr. Smith explains. When it comes to surgical interventions, Dr. Smith assures us that these are typically considered when non-surgical treatments have been exhausted or if the patient's condition is severe. Surgical procedures are continually evolving, he notes. Thanks to advancements in medical technology, we're now able to perform minimally invasive procedures with pinpoint accuracy. The journey of treatment doesn't end with surgery. Post-operative care is crucial. Dr. Smith explains, rehabilitation is an integral part of the process. It's about helping patients regain their strength and independence. This could involve a team of specialists, from physiotherapists to occupational therapists. Dr. Smith also highlights the importance of emotional and psychological support during this journey. A strong support network can make a world of difference, he says. It's essential for patients to feel understood and encouraged. Indeed, the journey of treatment is not a sprint, but a marathon. It requires patience, resilience, and a team of dedicated healthcare professionals. But as Dr. Smith points out, it's a journey worth taking. We've seen incredible progress in the field of spinal cord disorders, he says. Patients are living fuller, more active lives thanks to these advancements. And with continued research and technological innovation, the future of spinal cord treatment looks promising. There's so much potential for further breakthroughs, Dr. Smith concludes. It's an exciting time to be in this field. As Dr. Smith highlighted, the journey of treatment is a testament to human resilience and medical progress. Scene script. How does life change when living with a spinal cord disorder? We asked Dr. Emily Brown, a specialist in rehabilitative medicine. In the words of Dr. Brown, living with a spinal cord disorder is a life-altering event. It's a shift that requires adaptation, resilience, and a good deal of courage. But it's not the end of the road, far from it. She emphasizes the crucial role of physical therapy in managing these disorders. Physical therapy is not just about regaining physical strength, it's about reclaiming your independence, mastering new ways to navigate the world, and learning to adapt to the changes in your body. Dr. Brown also highlights the importance of mental health care. The physical challenges are apparent, but the emotional and psychological toll can be just as significant. Feelings of frustration, anger, and grief are common and completely valid. It's important to seek professional help to navigate these emotions. Mental health professionals can provide tools and strategies to cope and to build resilience. But it's not just about professional help. Dr. Brown stresses the importance of a strong support system. Family, friends, support groups. These connections can be lifelines. They offer emotional support, practical help, and most importantly, they remind you that you are not alone in this journey. Dr. Brown adds, it's critical to remember that each person's experience with a spinal cord disorder is unique. There's no one-size-fits-all approach. It's about finding what works for you, what helps you manage your symptoms, what aids your recovery, and what makes you feel empowered. She concludes, living with a spinal cord disorder is not just about surviving, it's about thriving. It's about finding joy, purpose, and fulfillment in your life. It may be a different life than you imagined, but it can still be a life filled with richness and possibility. Dr. Brown's insights remind us that while the journey may be challenging, it is not insurmountable. The spinal cord, a marvel of nature, yet vulnerable to various conditions. We've journeyed through the intricate network of the spinal cord, understanding its function, and the many disorders that can affect it. We've heard from experts shedding light on these conditions, the importance of early detection, and methods of treatment. Living with a spinal cord disorder is no small feat. We've peered into the lives of those managing these conditions, their strength and resilience serving as a testament to human spirit. But awareness is our most powerful weapon. Knowledge of these disorders, their symptoms and treatment options can make all the difference. It's crucial to maintain spinal health, as it plays such a vital role in our overall well-being. Remember to take care of your spinal health. For more enlightening content, follow Tranquility TV on YouTube, TikTok, Instagram, and Facebook. Don't forget to like, share, and comment. Together we can spread awareness and foster a healthier society.